morning, everyone. My name is Frank Jaskulke, and I'm your VP of Intelligence with the Medical Alley Association. And I'm so pleased that you chose to spend some of your morning with us today. We've got a fantastic discussion coming up on a really important topic, a really interesting topic, and one where there's some incredible innovation happening right here in Medical Alley. I'm going to do a couple of housekeeping things, go through the start of the program, and then we'll get to the content. First thing I always like to say is let's remember to have a little bit of empathy. We're still in this pandemic, post-pandemic world. Many of us are working from home or from different environments. We might have a kid, a cat, or something else that pops up. If it does, be understanding. I personally find it really fun to get to learn a little bit about each of your lives every time I get to visit with you, but have a bit of empathy. Second housekeeping thing, we're going to have questions throughout this. If you have questions you'd like to ask of the panelists, please use the Q&A function. You can use the chat, but the Q&A function just makes our job a lot easier to be able to get to your questions and to integrate them into the conversation. So anytime throughout, just pop the question in. I'll be watching them and I'll bring them into the conversation as it makes sense. The conversation we're going to have today is on a really important topic. Sometimes we think about technology supplanting or displacing people, but in healthcare, often what it really does is supplant and help people to better deliver care. And that is particularly true in the senior care market, where there's both an incredible need for innovation in business models, in technology, in payment, in policy, and where there's an incredible amount of innovation happening, as represented by the three organizations we have with us today. I'm also really pleased to say that our webinar series now has two wonderful sponsors, two great Medical Alley member organizations who have stepped up to support this webinar and to support the Medical Alley startup community in particular and make work like this more possible and easier to do. And so I want to give them a few moments to introduce themselves and their organizations. And I'd highly encourage you to go check out their websites, track them down, build the relationships, support the companies that support your community. I want to start with asking Joshua from a couple of gurus, if you would please say a few words.
Thank you, Frank. Yep. First, I just want to say that maybe someday I will have a cat sitting on my lap during these webinars. Love cats. But yes, I'm Joshua Davis. I work for a couple of gurus. I'm the operations guru here. And yeah, as Frank had mentioned, we are members of Medical Alley, and we just love having the opportunity to be able to sponsor Medical Alley. We are an IT company where we provide various IT services for businesses. Specifically, we are pursuing world-changing organizations, such as pretty much all the members within Medical Alley. We love helping companies who need to grow, who need vision for their company. So we really don't focus on the IT part. We really focus on the business because the IT kind of goes in line with that. So it's less about the IT, it's more about your vision and the business and where you're going. And we're going to make your IT in alignment with that. So we love partnering with world-changing organizations to do that because we're passionate about creating world changers and changing the world ourselves. So that's who we are and what we do.
Joshua, thank you. We really appreciate it. And I do have to emphasize that world-changing part. That's the thing we've all signed up for, and it's great to have partners who are along for that ride. So Kevin, if you would, from Diversified Plastics.
Absolutely, Frank, and thank you for allowing us to be part of this. I'm Kevin Hogan, CEO of Diversified Plastics. We're a employee-owned company that focuses on providing resin-based parts to med device, med tech, and other industries. Our acceleration station, which is part of the carbon production network and allows us to be in the additive manufacturing world, makes us uniquely qualified for emerging and startup companies. And that's why part of the reason we're excited to be part of the STARTS program. And this technology allows us to produce production quality and quantity of parts, not just prototypes, but in a fraction of the time without the need for tooling, which helps get products to market and to testing in the market faster. And once a product is on the market, then we can incorporate our other capabilities of in-house tooling, clean room technologies, et cetera, to help a company scale as they need to expand in the market. And in conjunction with the START's sponsorship, we're offering a service grant program which qualifying med device companies will be able to take advantage of engineering and production capabilities with us. So we hope to enroll a number of companies this next year. And qualifying med device companies will soon be able to get information on the grant program from Medical Alley and from Diversified Plastics. So we're excited about that and excited to be part of the program overall. So thanks very much.
Thank you, Kevin. We really appreciate the support. Diversified was one of the first companies to step up and say, we really want to do something more for this community. And I think it's really unique being an employee-owned company and a company that has a long history with the innovators in this community. So Kevin, Joshua, thank you so much for helping to make this webinar and so many other things we do possible. And with that, I'm going to turn it over to start the discussion. Again, as you have questions, throw them in the Q&A function. We'll be watching those and we'll integrate them into the conversation. The place we're going to start is the place you always want to start, getting to know the people you're going to be learning from today. So I'm going to ask each of them to do a quick introduction of themselves and of their organization, and then we'll dive in. And I'm just going to go in order of who I see on my screen. So Jason, if you would, please introduce yourself and LifeSpark.
Sure. Thanks, Frank. It's great to be here today. I'm Jason Winnell, CTO of LifeSpark. We are a senior services company. We focus on all pre and post-acute care. And as of most late, our vision and a lot of our energy is driving towards population health, building both the technology and the services to really create a new model of delivery for care for seniors. So thanks for having us.
Thank you. And then Julie, if you would.
Good morning, everyone. My name is Ament Gran, and I am the Chief Growth Officer for GranPad. The GranPad is a purpose-built tablet for people over 75. It's one of the first mobile devices of its kind addressing usability, security, and connectivity issues. GranPad has developed engagement solutions to improve health and well-being for older adults by reconnecting them with their family, friends, and caregivers. So we are also excited to be here and part of the conversation today.
Julie, thank you. And then Karl, if you would.
Yeah, absolutely. I'm Karl Ulfers. I'm one of the co-founders and CEO of a company called Duos. And we're really focused on helping older adults be able to age independently within their homes and providing caregivers peace of mind while we do so. And we do that through a hybrid of both technology and a workforce of personal assistants that will help these older adults and their caregivers coordinate everything that needs to happen to help them age and age safely from a home standpoint. And then we go to market both from a direct consumer perspective, as well as we sell to big, large enterprises such as Medicare Advantage plans, long-term care insurers, et cetera. And so we're really excited about the space and looking forward to the conversation today.
Thank you. And Julie, I want to start the first question with you, but I'm going to ask all three of you this. And it's asking you maybe to set the stage a bit of what are some of the technology challenges that you see in senior care, and how are they changing, say, today compared to what they might have been a few years ago?
Yeah, a great question. Thanks for asking it, Frank. Really what we've seen is with COVID, there's been this movement towards telehealth. And so as we think about that, it's always important to remember older adults. And so, recently was in a conversation with an organization of like, let's just do telehealth for older adults. And many older adults don't have access to broadband is kind of our first opportunity to overcome. And then secondly, really a platform to be able to conduct that telehealth visit. And so, what we've really seen is, partnering with organizations to provide a solution that can really meet both of those challenges for older adults. I think the other piece that goes with that, assuming they have technology and broadband, is really just being able to use that technology and feel confident in using that technology. So many people feel intimidated by technology, and it's really a goal of how do we continue to build that confidence of those individuals. I'd say prior to COVID, very little usage in this space. And coming out of COVID, it's really thinking about how technology can be and how can we do in-person visits and doctor's appointments when necessary? How do we look at technology as an and use that when it makes sense in cases like behavioral health or occupational therapy?
Oh, it's a great point. It's an and, not an or. And then the
Exactly.
broadband issue is well said. That's a policy issue I didn't think I'd ever work on. And telehealth has really pushed it to the fore that we have to have that figured out, or so much of this just doesn't work.
Exactly.
Jason, I'd ask you the same question. LifeSpark has a really unique business model and way of going to market. How has the technology challenges for what you guys do changed over the years?
Yeah, I think they've transitioned from from a technology standpoint. I think we're getting past the integration piece of just sharing data back and forth. But when we think about value-based care and a longitudinal relationship with a senior member, it's not just the technology that needs to continue to be interoperable, but also the services across multiple organizations. So I would just say that combination of people and technology over more of a value-based longitudinal path continues to be a challenge, and one that we're right at the forefront of helping solve.
That makes me think of, I've seen a lot of people talk about how when Netflix started, it was all about technology problems. Now it's all about TV problems. And healthcare seems to be going that same way of, it started with technology issues. Now it's healthcare issues, which is probably where we want to be. Karl, how are you guys seeing this? You're a really new startup, kind of building up from the ground level. What is it like in your world?
Yeah, for us, it's, we really focus on the technology challenges in terms of the people that we serve and the people that use our platform to enable our mission. And so, if we start, we really have two key people that we serve with our business. It's the caregiver and it's the older adult. And what we have found is that, it's just for context, we serve people in some various geographies across the country, one of which is in rural Georgia, and another of which in Pennsylvania. And then we have people that we serve through our direct consumer business all over the country. But what we see is a very clear digital divide that exists between urban and rural areas. And we have to modify our approach based off of that divide. And so to get, really specific, we've got older adults that we service that are in areas where, frankly, broadband isn't an option. And so one of the first things that we'll do, and, the partners that we work with, oftentimes will have services for these older adults that will get them connected into a solution like GranPad or, with a cell phone, et cetera. And so we'll actually use our engagement with that older adult to help close that digital divide. And then that gives us the ability then to have an ongoing relationship with them through that connection that we've then made. And then on the caregiver side, oftentimes they do have the technology and they have the aptitude around the technology, but what they really need help with is how we can use the technology to integrate in all the services that they're trying to pull together on their own for those older adults and loved ones in their lives. And so that's where we really help them from a technology and service standpoint, is by taking the needs that they have and having them then accessible through our service.
All right, so Karl and Jason, you both talked about the integration into the broader services. Maybe Jason, could I ask you to expand upon that a bit? What's the challenge there? What's the gap that remains?
Well, I think we're going to talk about kind of holistic care a little bit later, and we'll get into that more depth. But if you think about the continuum of care, everything from a hospital system to home care to a dentist to someone who's helping walk the dog, right, or delivering food, it's getting those systems to actually be able to talk to each other, share data, but then also the providers to be able to be open to what can I learn from that data and how does that change how I might serve this person. And so connecting all of that, and we don't even like to use the word care, but that experience for that member is a challenge and an opportunity, and just something that the value-based programs are really helping us pioneer, because all of those matter, right? And the data from all of those experiences actually matter when we think about caring for our member.
Well, maybe we'll jump into the holistic piece. That's a good point. And Julie, this is something that's kind of unique about GranPad, that GranPad started not as a healthcare company, and correct me if I'm wrong, but maybe you wouldn't say you are a healthcare company in some sense. started in consumer technology more. Can you talk about the broader challenges that, like, for example, GranPad solves for, and why those are important to the holistic health of a person?
Yeah, you hit it right on the head, Frank, is our company started as really a consumer offering. Our co-founder, Scott Lean, had a challenge with communicating with his mom, being distant from her. And it was really about, how do we make this easy to connect with older adults that maybe haven't experienced technology. So for a good portion of our time as a company, it really was on this consumer front of solving the problem. How do we reconnect older adults with their family, friends, and caregivers? And we've created, a custom solution to do that. But along the way, we've been working with different businesses to implement along the way our product. And so COVID hits, and all of a sudden, we start working with a lot of healthcare companies that say, gosh, we've got to be able to reach this population. And how can we do that in a safe and secure way? And so what we found is there's certainly a telehealth component of, we want to be able to, perhaps have a behavioral therapy session via telehealth. But what we have found, and is very rewarding for us, is the ability to also then connect the individual with their family, friends, and caregivers. And I heard of a wonderful story just this week where someone was very hesitant to have that telehealth visit. Well, fast forward 2 weeks, and they've now had 9 video calls with their family. And it just gives us such joy in being able to kind of solve 2 things, right? The social determinants of health piece of it, as well as being able to connect them to their doctors and their providers. And so it makes me smile on a daily basis.
Oh, that's fantastic. And I can say from personal experience with family members who have used it, where those things that we probably don't think of as being part of healthcare really are a part of healthcare. And Karl, I know, kind of core to your guys' business is that support for the individual that's in your care. Can you talk a bit about what is the duo in duos, and what does that person do to support the person they're caring for?
Yeah. So I'll start with who are these duos that we have working for the company? The duos are personal assistants, and they are primarily we've really tapped into the 9 to 3 economy of stay-at-home moms and dads. We did that because we did a lot of research with older adults and caregivers on who they would actually want to work with. And what we found is they want to work with people that have real life experiences, either in terms of taking care of kids or taking care of older adults and loved ones in their lives. And one of the big challenges in our space has always been there's not enough supply of sort of traditional in-home care workers to deal with the amount of demands, and that problem's only going to get worse. And so we've really tapped into this as a whole new labor supply. There's about 11.5 million Americans that sort of fall into this category. And so we're really excited about that, and we've been able to grow pretty rapidly within that pool. And we've actually partnered with another Minnesota-based company called Bus Stop Mamas, who's actually helped us tap into that labor supply. And then what they actually do is what we'd call, from a marketing perspective, social determinants on aging. They are really there to help. So when we engage with a caregiver or an older adult, we first understand what are the needs. And the needs could be transportation, it could be food, it could be house cleaning, it could be helping them coordinate their medical care and prescription medications. And so the first thing we do is we really get a picture of what those needs are. And then what we do as we engage with the caregivers and the older adults pretty much on a weekly basis is we actually line up and coordinate all of the tasks that surround those needs. And that's where technology for us plays a huge role, because it allows us to understand what those needs are and then tap into partners to easily coordinate and set up those services for the people that we work with.
Oh, it's fantastic. And yeah, shout out to Mary Kay Zinowitz and Bus Stop
Yep.
Mamas, another great startup in the community, and awesome to hear you guys are working with her. Jason, I want to ask you about the holistic piece. LifeSpark is taking what's a pretty large and established industry in one sense in senior care facilities, and changing it quite a bit. Can you talk a little bit more about the model of LifeSpark or what you're building, and then how that holistic care fits into it and why it's important?
Yeah, well, that's great. Well, similar, we don't really look at ourselves as a healthcare company as much as an experience company, and our main metric is that of trust in a relationship. And so, similar to Duos, we have something called a role, one of our most important roles, called a life manager. And that life manager is really that trusted advisor that's a part of that member and their family throughout the continuum of their time with LifeSpark. And they are on point to bring in multiple services, to be at the hospital, to be part of the discharge team, to deliver home care. They're an RN by nature. And then they bring in doctors, NPs where needed, but are really that quarterback and sit on that family's team throughout. Our goal is the full kind of 7 to 10 year journey with LifeSpark that they're with us. And then we use technology to really help support that, right? And so we have something called the electronic life record. We don't deal with medical records. To us, it's a life record. And we build out life plans, not care plans. So everything that you see at LifeSpark is around really getting to know our member, utilizing the best of data we can to get a better understanding of their complete situation, building out a life plan with them that's really focused around their goals. The reality is they care about getting out golfing or going on that trip in January, and not about getting their hip fixed. And ultimately, we all know those SDOH elements actually contribute a lot more to their health than we even thought before. And so our combination of high touch service with the life manager, as well as technology enabling that relationship to flourish and to be more proactive and more prescriptive, and how to help them with everything in life as opposed to just reactive to their healthcare needs. And so that's really our model, and the value-based payment model helps support that, and that we can go at risk for larger populations and deliver that model without worrying about every single episodic event as being the main element.
We're going to come back to that value-based care piece, because I think that a really important aspect of how these sorts of businesses work or don't work to be able to deliver the life or the care that's needed. There's a question from the audience that, Julie, I want to ask you. Glenn is asking, is it better to help the seniors develop the skills to use the existing technology, or to develop the technologies that are better served for what they want to do or for their skill sets? Like, where do you land on that with GranPad?
Yeah, it's a great question. Our product is, I'd say, generally designed for those over 75. So safe and secure, custom hardware, custom software. I'd say what our secret sauce is really our member experience or world-class customer service. And what they do is they meet the senior where they're at. So, certainly we're ever evolving in, things that we add to the GranPad based upon the work we do both on the consumer side as well as on the partner side. But it's really, we pay very close attention to our customers. We have an internal advisory group. The youngest is 79 and the oldest was 106. He peacefully passed away this last Christmas. But as we add technology and they have a wide set of skills, it always goes in front of them first. And so, we really think about the personas that we serve and how we make sure we keep true to that mission. There are times we talk to partners and, perhaps they serve a population of 45 to 65 might be their lane, if you will. And we might not be the technology for them. So I think it's important to understand sort of who you serve, and we are ever evolving. Unfortunately, what we find is as people age, some people do have experience with technology, but there's unfortunately cognitive issues that come into play that we haven't solved yet. And so, we feel like we continue to meet multiple sort of needs on that front as well. So that was maybe a little long-winded. Sorry, Frank.
No, that was fantastic. Thank you. I want to shift now to what might be the question that's on all the listeners' minds, which is around business model, and coming back, Jason, to the value-based care item. For many years, we would talk with innovative companies, large and small, and they would constantly identify this challenge of, we sort of all knew what we should do, but you couldn't make a sustainable entity doing things that way because the payment models weren't aligned. it seems like, especially with the changes that came out of the pandemic, that the payment models, the policy is getting more aligned to paying for the life or the care that really does create value. I want to ask each of you two questions on this. One is, do you agree we are moving in that direction? And how far along are we? Is it far enough in your view that we've hit a tipping point or we're near it? Or do we still have a lot of room left to go to make it truly sustainable? And Jason, I might start with you on that one.
Yeah, no, great question. I think we are here. LifeSpark's been doing this for a decade without the payment methodologies fully aligning, really because it was the right thing to do. And we saw in the data that we were keeping people out of the hospital 50% of the time by just delivering that level of care. We just weren't getting paid for it, right? And so finally, with some of our latest contracts that allow us to go full side, upside, downside risk for a population, we can kind of put the money where the mouth is and say, no, we will take on the risk, provide the model, and we believe, because of our last decade of data, that we're going to move the needle on cost, but more importantly on experience. And it's really a true win-win. We talk about our motto is helping people age magnificently, and the fact that we can do that in the place where they want to get care, and do it in a business model that makes sense. Joel would say, our founder, we're finally at that holy grail moment where we can connect all those pieces. And it even furthers with things like direct contracting, of which we're one of the first providers in Minnesota for high risk, or only for high risk, that allows us to do direct contracting direct with CMS. And so those innovative programs continue to allow us to deliver our model and have it be a win-win, both for the consumer as well as from a business model standpoint.
Oh, very good. And then what about, where does it still need to go, or what's left to kind of push it over fully?
Yeah, I mean, I think personally, it's the adoption of these models. You know, as we move from what we consider kind of the sick care or acute care system, it's muscle memory from the provider side around this is what we're used to, and this is what we've had, and how do we really change that mindset? When I talked about that, it takes that full interoperability of all these services coming together to think about it that way. It can't just be LifeSpark or Duos or GrandPad. It has to be multiple providers because we need everyone to really provide that really good value-based care for that member. So I would just say it's that moving of an acknowledgement of that alternative delivery system, and certainly the pandemic helped. You like to see the positives out of the negatives, but it helped push us a little bit towards this new model, new era of how we might deliver healthcare. And so I think we're on a good trend, but still have a ways to go for sure.
And Karl, I'd ask you the same two questions. How do you see it today, and what is still left? And maybe I'll add one more item for the group, which came in from the audience. Danny's asking, how do these models work when we start talking about low-income older adults, maybe Medicaid or dual eligible type patients?
Yeah, for sure. Why don't I start with that one, and then I'll go into the other two because they actually directly connect together. So I will just tell you, we actually engage with a lot of dual eligibles in our service, and as such, we actually will service individuals that are 55 plus, because what we see in that 55 plus population is there's very similar needs when you're dealing with somebody from a dual standpoint that you would see with somebody that's 65, 75, 85. And so that population is interesting. The reason that population is interesting is because there have been changes within the way that reimbursement now works from an overall CMS standpoint that opens up a budget for you to actually be able to tap into with Medicare Advantage plans and duals providers. And that is SSBCI. So those up until 2019 in healthcare, you could not vary the benefit coverage that you gave to somebody based on their level of illness. And with SSBCI, which are basically the easiest way to think about it is supplemental benefits for the chronically ill, they give you the ability to actually, as a health plan, give richer benefits to those people that are sicker. And so as a result of that, we have been able to then service those populations because the health plans can cover us as a service for those populations. The other big change that happened was in 2018, Frank, which is CMS expanded what they called social needs benefits, which are effectively benefits that allow for plans to go after the social determinants of health, and cover those as part of their plan designs and cover them under medical loss ratio versus administrative fees. And so those two big changes are really what are creating the opportunity for a company like ours to have a viable model in that part of the market. So I think that's, to answer the first part of your question, those are the changes, and I think they've come a really long ways in the last couple of years, which is a incredibly short period in the healthcare world. The area where I think it still needs to continue to go is you still have a lot of Medicare that is fee for service. And CMS is trying on traditional Medicare through DCEs to shift providers from fee for service into more risk-bearing arrangements like they have with Medicare Advantage plans. But I think it's going to be a really long road. And so when you think about it, Medicare Advantage plans make up, over a third now of the overall Medicare membership, well over a third. But that rate's going to need to continue to shift, or the traditional Medicare is going to need to continue to shift towards more risk-based to really allow this entire category to continue to thrive.
Maybe a follow-up on that. Jason mentioned the taking up and down risk. There had been some of the early value-based care initiatives that were out. There's more upside benefit potential than downside risk. Where do you see that today, and how important is it to have downside risk in the equation?
Yeah, well, for sure with the direct contracting entities, they are shifting the model to be more upside and downside, which is, which I think it does the right thing for the healthcare system. That's part number one. Part number two is, for us, what we have seen is because we can get embedded in as a benefit, we, on the health plan side, it's more about quantifying the total value proposition outside of just medical cost savings. So for us, that means impacts that we can make to stars, impacts that we can make to medical cost savings, and then impacts that we can have on the acquisition and retention side. That's on the plan side. On the provider side, 100%, you're going to need to be able to take upside and downside risk, without a doubt. Because that right now, as the way the system is wired, that is the only way you're going to get them to have the skin in the game that's going to allow them to, or have you have the skin in the game that's going to allow them to want to put you into your solution. So I think when you talk about risk, you kind of have to bifurcate between the plans and the providers, because the incentive system today is not the same between the two from a federal government perspective. So you have to modify your economic model based off of that.
That makes a lot of sense. And then, Julie, I want to ask you about it, because GranPad has both a B2B type model, but also a consumer model. For those of you who don't know, and call this the commercial, you could go to Target and pick one up for your family member today. So, Julie, when GranPad's looking at the shift to value-based care and the way this world is changing, how does the consumer piece fit into that? Or how do you think about this maybe dual strategy of B2B and direct-to-consumer?
Yeah, it's a great question. And as my colleagues Jason and Karl talk, we're still very new to this space around becoming educated around CMS and guidelines and things of that nature. So, from a consumer standpoint, we do offer our product online, and we've certainly, kind of to Jason's point, seen growth in that side during the pandemic of people wanting to, stay connected. So, we often do get questions on the consumer side around reimbursement and those pieces. And so, there's still a lot of opportunity there for us to understand and how we might play in that space. We know there's been a number of bills coming forward in terms of, reimbursement, emergency broadband projects, things of that nature. So there's a lot of work to do on that side. On the B2B side, we work with a lot of partners or organizations that face some of the challenges that Jason and Karl face in terms of reimbursement, and really seeing, the value and seeing that we can keep people, out of the hospital and provide great care in a variety of ways, using telehealth in addition to that traditional care. So, long-winded answer again around just, there's a lot for us to learn in this space. I think there's a long ways for the country to go in terms of reimbursement. So I'll broadly say that, sometimes I I worry that we had this COVID experience, and now there's probably a human nature to say, let's go back. We all want to return to the way we were. And I think those of us on the call want to say, well, how do we take some of the sort of silver linings from COVID and move that forward and try to have an and versus we don't have to go back. So I'll stop there.
No, that is great and right on. And I think we all agree with that. And I'd say that, a unique thing that you bring is that direct to consumer side that most often in healthcare is not a muscle that we've had. It's starting to grow, it's starting to build up, and there's all these interesting opportunities in the community for these different technologies, different business models to come together and create something new and better than what we had before in the old normal. Like, let's stay away from normal. And that's where I kind of want to shift to this last topic for the discussion, which is, Julie, what you just started getting to around some of the barriers or the risks that are there. So it sounds like made pretty significant progress, but healthcare is huge. It's $4 trillion in our economy. It's incredibly complex. It involves technology and people. Jason, I'll start with you to ask, what are the things you're most worried about as slowing us down or pulling us back to the way things used to be and shouldn't have been that we should be pushing against or working to not let happen?
That's good. It's a great question. I already mentioned the kind of walled gardens that happen around all of us as providers, and we can all kind of sink into that of like we have our fiefdom of how we're taking care of our members, and we're not looking outside of connecting to everyone else. So I think that's one continued barrier that we need to get past, both from a technology standpoint as well as a people process standpoint. I think the second one that I guess I just have a dream for is we're still at, from a technology standpoint, where it feels like both for the provider and often for the consumer, we're at a this is work standpoint. It's still from a billing documentation for a consumer. It's around I have to put a blood pressure cuff on, and it's still a hassle. And so I'd say there's still barriers as far as technology looked at as actually providing value, as opposed to something that can be frustrating to both the consumer and the provider. And our dream is that we help make technology more invisible, and that the technology is in the background, and we allow that relationship to flourish and to get data, to get things like blood pressure and pulse ox from ways that are not just are more of a hassle to that member. And so I don't think we're there yet. We're kind of going over this hump of getting technology in the door. And then ultimately, hopefully, it starts to be a little bit more invisible to the overall experience, and really is around that providing care and relationship. That technology is just supporting that. So I still think that's a barrier, but we're making really good progress on it.
That experience piece you've hit on a couple of times, and it's so important. And I will say this is like just a personal experience thing. Being in this industry, we so often talk about like all the great tools we could give people and all the things to help them manage their condition. And just imagine, like, does anyone want to be sick and manage their condition, right? It's not the experience you want. So that background piece, Jason, I have to say, is well taken, right? Like, part of life, we have to deal with it, but it should be seamless and easy. Karl, from your perspective, what do you see as like the risks that's still out there or the barriers we need to remove?
Yeah. Well, I think we've talked about them from sort of a business model perspective. And I think, frankly, those barriers are coming down. I think, the biggest risk is really making sure that we get solutions like these out to the people that really need them. And what we have found is like I mentioned earlier, we have got the older adult who we directly engage with in service, but we also have the caregivers. And I think, fortunately, enough research is now coming out in terms of the health impacts of caregiving to unpaid caregivers from a family perspective, that it's starting to drive broad-based awareness of how dire this situation is and the needs around it. The CDC has done a tremendous job in the past year, largely because COVID has exacerbated what was already a really challenging situation, highlighting the impacts to caregivers. And, the statistics are really sobering. somebody that's a caregiver versus a non-caregiver, their substance abuse levels are 10 times those of a non-caregiver. Their depression and suicide rates are 5 times the level. The CDC just came out with research 3 weeks ago that's highlighting, for somebody that isn't caregiving, they might actively contemplate depression and suicide, suicide 4 to 7% of the time. For those that are caregiving, that rate is in the 50% percentile. And so it's really shown this need to service both the older adult and the caregiver. And I think that is an important barrier that we continue to tear down, because the silver lining in that research was that if there is a solution in place, like what we do at Duos, like what LifeSpark does, et cetera, that is the only way that you can actually directly ease that burden. And so I think we need to make it socially acceptable for people to be able to tap into services like ours when they need help, so that we can, take care of all this administrative, really important work for that older adult in their life, and they can continue to be that loved one for that older adult and not have to do both.
Well said, and so important. And then Julie, what about from your perspective at GranPad? What are the barriers you still see out there that we need to push again?
Yeah, it's a great question. And of course, our space is a little bit different, but I think it is really about, bringing that awareness forward of connecting those loved ones, and kind of like, Karl said, it's really thinking about the family, and in this scenario for telehealth, of thinking about how they can participate in that care and have that connectedness to their loved ones. So I think that's a piece of it. I think just continuing to bring that awareness. I will be a little bit of the broken record on the end, but I feel like we've made so much movement this last year, during the pandemic, of seeing the digital equality for all the people we serve, and really thinking about how do we make sure older adults have what they need to participate and to live their best life, and in a well situation and in a situation where they're not well, and really make sure that they're connected. I think there's so much knowledge and insights from our older adults, and I think sometimes that's dismissed in our society. And so how do we make sure we celebrate that and acknowledge and make sure they've got ways to connect to not only their healthcare providers, but their family and loved ones.
Oh, well said, and so very important. And I think you're all highlighting that the innovation that's needed is so much broader than what we've maybe traditionally thought of occurring in the hospital or occurring between a doctor and a patient. Last question time, and this is a question where I'm hoping you'll paint a bit of a picture that for our attendees out there who are working on all kinds of different innovations, you'll get them thinking about their world a little bit differently. But if you project ahead, say 5 or 10 years from now, which, as was said, in healthcare is not that long of a time, but it's enough of a time to be maybe outside of our usual strategic planning cycle. What does the world look like if it's done the right way, if what you're doing is successful? What is the world we're then living in? And Jason, I'll ask you if you'd start.
Sure. Our vision at LifeSpark is truly that in 5 years, hopefully even before that, when I talk about alternative delivery systems, if you think about the current kind of what we call sick care system, that alternative that is value-based, longitudinal relationship, holistic, from the home as opposed to from the institution, that delivery system is actually becoming the primary delivery system for our seniors, as opposed to a supporting delivery system. And we think that will both be a win-win for providers, for the employees of our provider organizations, for the family members, as well as the members themselves. And we think that we're on a good path towards that, but there's still a long ways to go. Along with the other thing I mentioned, just when we talk about combining technology with that, is that technology starts to become more value add and less of a frustration. And that's through all the work of everyone on this call, continue to try to pioneer technology to help support that model, as opposed to make it more and more difficult. So yeah, we see that space. I think part of we got into senior living facilities because I think the other just point I'd bring up is we need to think about the kind of total cost of care. So the whole wallet for the family, for the member. It's not just what they're spending in Medicare, but it's the flights for the family member to come in. It's the housing costs. And so we really need to think about that full picture for a senior and their family, and really change that over the next 5 years to bring down the overall cost, as well as to increase the experience. And we think that we're on a good path to getting there.
That's fantastic. And I share your optimism that in less than 5 years, we'll see meaningful changes that change even the dollar amounts that are going into it. Julie, what about you? What do you see? Look out 5 years from now. What's the world we should be living in?
Yeah, I'll start with, our aspirational goal, which is really, making sure that no older adult or senior is lonely. And I realize that is a very aspirational goal. But sort of, coming down sort of a step from that is, how do we make sure that older adults have the ability to connect to their family, friends, and caregivers, and make sure that, that is done in a way that we can meet and support them and, build that confidently for them and celebrate their life. So I think at a high level, that's what it is. It's also then thinking about, particularly in this space of healthcare, how do we make sure that we, leverage in-person visits when it makes sense and leverage technology when it makes sense. And we often, think about sort of that person that is now in a situation. How do we, if you will, sort of think about that in a format, if you will, meaning how do we make sure people have technology and we're doing wellness visits in a telehealth way? How do we make sure that they're connecting to their caregivers when they need to, before they need to? And so sometimes I do live a little bit in a dreamer's world, but making sure that our older adults are not only connected to safe and secure healthcare access, but also connected to their family and friends, because it has such an impact on their life. And, we want people to age and celebrate their life and live the best life they can. And so we want to be able to support that.
That's fantastic. And I'd say that the big aspirational goals are the only ones worth having. And Karl, I'll give you the last word on it. How do you see the world 5 years from now?
Yeah, I'll start by going, Frank, 10 years out, because I think there's a really important deadline that we should all be aware of, or milestone that's going to happen 10 years from now, more or less, which is at that point, our country will be in a place where there are more people that are over 65 than there are less, specifically from a children perspective. And so that is a critical point. And the reason that is so critical is because you're going to have far greater needs than you even have today. And you're going to have less ability for unpaid caregivers to close the gaps that have put us in the situation that I just described a little bit earlier. So when we go out 5 years from now, where I think we all aspire to be, is in a world where we actually can have services that allow these older adults to easily age in home independently and in a healthy way. And I think that is very obtainable. It's going to take a ton of really hard work. But the reason I think it's going to be so attainable is 9 out of 10 older adults want to be able to stay in their homes. So the desire is there. Now it's on us to provide the solutions. In, GrandPad is an example, LifeSpark is an example, Duos, all of us together, that's going to actually allow us to build that ecosystem to enable that to happen, because the way that it's happening today is just not sustainable. And so it gives great cause for us to rally behind and make it happen.
That's fantastic. Thank you. And I want to say thank you to all of you for sharing your insights and your thoughts on what's going on. Thank you to our attendees for participating today. I hope you came away, learned a couple of new things, and got a different lens to look at your own work and how you're working to innovate. And I also want to say thank you to Diversified Plastics and a couple of gurus for supporting this work. I hope you all have a great rest of your day. For those of you that are members, thank you for supporting the association. And if you're not a member, you should reach out and we should have a chat. I hope you have a great day and talk to you later. Bye, everyone.